Hello, I'm Dr. Mary Manis. I'm happy to talk with you today about professionalism in osteopathic medicine. This will be an introduction with 5 W's and a how. Our objectives are to introduce professionalism in osteopathic medicine and introduce expectations for professionalism for you osteopathic medical students here at the COM. Again, my name is Dr. Mary Manis. I'm an assistant professor of the Department of Primary Care and Clinical Medicine at the COM. I'm a course instructor in several sessions. I'm also a course director for Clinical Medicine 3 and clerkship director for Rural and Underserved Medicine. So we'll start with our first W about professionalism, the what. Requirements for a profession. To be a professional, to be a medical professional, you must acquire pertinent, designated, adaptable, even changing knowledge and skills. You must be able to apply those knowledge and skills within an ethical framework. You must be able to maintain a contract with society. You must be able to bond with peers by a shared commitment. We take that to mean benefiting patients. And you must be able to regulate peers as well as self-regulate. Responsibilities include the acquisition of pertinent knowledge and skills and the application within an ethical framework. The COM's educational objectives for professionalism, in fact, include a requirement for you to develop lifelong learning skills and for you to commit to ethical principles and demonstrate behaviors of respect, compassion, probity, honesty, and trustworthiness. And please don't make me look up probity, although you can later. Accountability. Educational objectives for professionalism for accountability demonstrate such to patients, society, and the profession, as well as demonstrate awareness of and attention to issues of culture, religion, age, gender, sexual orientation, and mental and physical disabilities. You will also be required to work within your learning communities to develop relationships which promote compassion for and understanding of oneself and others, as well as demonstrate ability to provide for self-care, to maintain physical, mental, and emotional well-being such that you can carry out your responsibilities and your accountabilities. So we know a little bit about what professionalism is. Why do we feel it's so important? Well, it's included in every learning objective list for every course. You'll find it, as I said, in every syllabus. It is included in every medical licensing exam, mainly in the medical jurisprudence portions. It's included as an expectation for entering residency. It's included in residency training requirements, and it's included in credentialing for any practice, employment, hospital or other facility privileges, Medicare or other third-party payer contracts. It will be something that everyone who interacts with you in your role as physician will expect. Responsibility and accountability. Transcripts, letters of reference and recommendation, proof of training. This will be a forever requirement for you. I also want to point out that there was a case-controlled study done in 2005 with an interesting finding, and it hasn't been disproven since, that disciplinary action among practicing physicians by medical boards was strongly associated with unprofessional behavior in medical school. In fact, students with the strongest association were those who were described as irresponsible or as having diminished ability to improve their behavior. So students who were unwilling or unable to fulfill their responsibilities, or those who were unwilling or unable to accept feedback, assessment, or evaluation and use it to adapt and change their behaviors, were those who had subsequent difficulties. So the when. You will be expected to demonstrate professionalism beginning August 10th, Monday, 8 a.m. That's when you officially become an SHSU COM osteopathic medical student. You will be required to abide by programmatic level educational objectives for professionalism. You will need to follow the SHSU COM student handbook, and that includes our honor code, as well as the university's Code of Student Conduct and Discipline. The American Osteopathic Association, in fact, would like you to follow its rules and guidelines for physician conduct and behavior beginning Monday, because it specifically includes you as osteopathic medical students, as well as those of us who are practicing physicians in osteopathic or allopathic medicine in its rules and guidelines. So the where. Professionalism will need to be demonstrated by you in every educational activity. Specifically, of course, clinical anatomy, osteopathic manipulative medicine, and clinical medicine in your preclinical years, and clinical clerkships and electives in your third and fourth year, as well as any university extracurricular or other interprofessional health student activities. As a practicing osteopathic physician, you will need to exhibit professionalism in every interaction, in every setting. You will need to, in fact, consider those who are not traditionally healthcare settings for their context, as unprofessional behavior in certain contexts may bring adverse consequences. The who. You will need to demonstrate professionalism in every interaction with every patient and even their surrogates. I've outlined these in a diagram. Patients could be families, caregivers, research subjects. Society is represented by health systems and healthcare teams, peers, professional organizations, medical boards, and self. This is mirrored in expectations for professionalism for preclinical osteopathic medical students. Every interaction with patients or their surrogates or stand-ins, this certainly includes anatomical donors, clinical scenarios in scientific foundations courses, role play, standardized patients, simulated patients, clinical cases even in systems courses, or any research subjects you deal with. Patients' representatives could be faculty, staff. We stand in for patient as their representative when we interact with health profession students. We can even consider patients' representatives as comm administration and leadership. When we interact with peers and peers representatives, this could include student organizations and even Sam Houston administration and leadership. So the how. I think this is the key. I think professionalism needs to be viewed as a skill. The how is the most important part of learning about professionalism. But the how, the skill, cannot be learned just by studying and observing, although those are necessary. The how is the skill, and learning it is an active process. It must be practiced, professionalism must be assessed, and then improved in a repeating cycle that travels through Monday, through your competency in professionalism, onto mastery of your professionalism as a skill. So how do we assess you in professionalism? Each of the activities in the where, when, and who are opportunities for assessment. Your journey begins Monday, 8 o'clock. Your success is our success. This slide is to remind you that I would like to personally welcome you to join the honorable profession of medicine. And I don't think I will be giving you much more advice. I'll try not to, but this is my one piece for orientation. Master the skill of professionalism, and you will be successful in fulfilling your responsibilities and accountabilities as a physician for and to patients, peers, and society, as well as to yourself, for as long as you study or practice medicine. I greatly appreciate your attention. I know this has been a long day and a lot of new information. This particular presentation will be posted to the Clinical Medicine 1 course. We will be touching on all of the aspects I introduced today, and I look forward to working with you towards your future as a professional in the practice of medicine. Thank you.